Hey everyone, and welcome back to MediByte. Today, we're going to talk about a virus that's, well, it's probably already inside most of us, even if you've never heard of it. It's called Cytomegalovirus, or CMV for short.
So, let's kick things off with a stat that might just blow your mind. Are you ready for this? About 80% of adults across the entire globe have been infected with CMV at some point. Yeah, you heard that right. That's 8 out of every 10 people. So this isn't some obscure, rare disease. It's basically a silent companion that the vast majority of us carry around every day. So in today's explainer, here's what we're going to cover. We'll look at what this virus is, how it gets around so quietly, when it actually wakes up and becomes a problem, how doctors even find it, and of course, what we can do to manage and treat it. All right, first up, let's get to know this virus. What exactly is this little microbe that's hiding out, completely undetected in most of us? So CMV is part of a really big and pretty famous family, the herpesviruses. Specifically, it's known as herpesvirus type 5. Now, you're probably way more familiar with its relatives. I'm talking about the viruses that cause things like cold sores, chickenpox, and even mono. And just like its cousins, CMV is an absolute master of hide and seek. See, after you first get infected, which, by the way, is usually so mild you don't even notice, the virus doesn't pack its bags and leave. Nope, it just goes to sleep. It becomes dormant, staying inactive inside your cells for the rest of your life. But, and this is a big but, certain things can wake it up or reactivate it, and that's when things can get serious. Okay, so if it's already in 8 out of 10 of us, you have to wonder, right? How on earth does it spread so well and so silently? Well, CMV gets around through close contact with an infected person's body fluids. We're talking about saliva, urine, semen, even breast milk. It can also be passed from a pregnant person to their baby during pregnancy, or through things like blood transfusions and organ transplants. But here's the real secret to its stealth. For most healthy kids and adults, a CMV infection causes nothing. 0 symptoms. Your immune system just takes care of business, and you're none the wiser. You never even knew you had it. Now, in those rare cases when symptoms do show up, especially in young adults, it can look a lot like mono, fever or feeling super tired, but there's a really interesting difference. The classic mono you hear about, the one caused by the Epstein-Barr virus, almost always comes with a wicked sore throat. With CMV mono, that severe sore throat is usually missing. It's a subtle clue, but a really important one for doctors. Okay, so if it's basically harmless for most of us, why are we even talking about it? Why does it matter? Well, because for certain people, this sleeping giant of a virus can wake up and cause really serious, even life-threatening problems. So let's talk about who is most at risk. We're really looking at 2 main groups here who are especially vulnerable. First, you have people with weakened immune systems. Think about someone with advanced HIV or an organ transplant recipient who's on medications specifically to suppress their immune system. The second group is newborns who get infected with the virus before they're even born. This is called congenital CMV. When CMV wakes up in someone whose immune system isn't at 100%, the results can be absolutely devastating. It can go after the retina in the eye, causing something called CMV retinitis, which can lead to blindness. It can infect the brain, causing encephalitis. It can even create these painful sores or ulcers, all through the intestines and esophagus. And for an unborn baby, the consequences are just as serious. A congenital CMV infection can unfortunately lead to miscarriage or stillbirth or cause major damage to the baby's liver and brain. And for the babies who do survive, there can be lifelong challenges like hearing loss or intellectual disabilities. So this all leads to a really tricky question, right? How do you even find a virus that's supposed to be invisible? Let's dive into how doctors actually diagnose it. Okay, first things first. If you're a healthy person and you just feel a little run down, your doctor probably isn't going to test you for CMV. And why not? Because for you, the infection is almost always mild and it's just going to go away on its own. No treatment needed. But when a doctor does suspect CMV in someone who's at risk, they've got a few tools in their belt. For a newborn, they'll often test a urine sample to look for the virus. Blood tests are great for finding antibodies, which can tell you if you've had a recent infection. If someone's immune system is weak, a doctor might even need to take a small tissue sample, a biopsy. And for eye issues, a specialist, an ophthalmologist, can actually see the signs of CMV retinitis just by doing an eye exam. But there's a really crucial distinction to make here. Just because they find the virus in your system doesn't automatically mean it's the cause of the problem. You might just be shedding the virus, which means it's active but not actually doing any harm. That's why sometimes a biopsy is the only way to be sure that the virus is actively attacking the tissue and causing disease.
All right, so let's move on to the final piece of the puzzle, managing and treating CMV. What can we actually do for people who get really sick from this?
Well, as we've said a couple of times, for most healthy people, the answer is pretty simple. We do nothing. Your body takes care of it, and the infection just goes away on its own. No pills, no treatment. But for those severe, life-threatening cases, that's when doctors bring out the heavy hitters, powerful antiviral medications. You'll see drugs like ganciclovir and foscarnet being used to fight back against the active virus. Now, it's really important to get this. These drugs don't cure the infection. The virus will always be there, dormant in your body. But what they can do is suppress it and stop it from doing more damage. And of course, prevention is a huge deal for these high-risk groups. People who get an organ transplant are often put on antiviral drugs right away, just to keep CMV from ever waking up. And for people with HIV, the best defense is simply effective treatment for the HIV itself. That keeps their immune system strong, and a strong immune system can keep CMV in check all by itself. So when you step back and look at it, we have this virus that lives quietly inside most of the human population, but it can be devastating when our defenses are down. It really makes you think, doesn't it? What does this sleeping giant of a virus really teach us about the incredible, around-the-clock power of our own immune system?
And that's our look at cytomegalovirus. Thanks so much for joining me today. If you found this explainer useful, it would mean a lot if you'd hit that like button, maybe share it with someone you think would find it interesting, and of course, subscribe to the MediByte channel for more deep dives into health topics. We'll see you in the next one.